Hi, my name is Macy Sakai, and the study that I will be talking about is an investigation of how wrist position may have an effect on muscle force production, as well as motor unit activation, which can be determined by electromyography, or EMG. We know that muscle length plays a role in muscle force production, and there has been research studies that have found that force production is decreased in a flexed position or when the muscle is at its shortest length. By using a hand grip dynamometer, we are able to determine how wrist position will affect overall force production and use surface EMG to measure motor unit activation of the wrist flexors and extensors in those varying positions. We hypothesize that the standard wrist position will likely yield greater force production due to the concept of link tension, and that the EMG activation of motor units for both the flexors and extensors would be greatest in that position as well. The subjects were volunteers from Regis University's Physical Therapy class of 2019. Their age ranged from 23 to 36 years old, with a mean age of 26.9 and a standard deviation of 4.6 years. They were able to perform a maximum grip test with their dominant hand, did not have any wrist or upper extremity injuries, and were not allergic to latex. To perform the tests, we had the individuals standing holding the hand grip dynamometer in their dominant hand with elbow at 90 degrees, shoulders relaxed, and elbow away from side so as not to touch their body. The subjects performed a maximum grip test in standard position and then repeated it for the different wrist positions, including having the hand grip on shortest setting, hand grip on longest setting, and wrist in maximal extension and maximal flexion with the standard grip. The results showed that the EMG activation of the wrist flexors and extensors were not significantly different between wrist position. This is most likely because during contraction, both the flexors and extensors are activated and motor units are recruited regardless of the position. However, we did find that the standard position yielded the greatest amount of muscle force production due to the sarcomere myofilaments being at an optimal length of overlap. We also found that the force production was the lowest when the wrist was in maximal wrist flexion at 45% of standard position force. This could be due to active insufficiency since the muscle is in a shortened position. The clinical relevance of this study is that it allows us to determine the optimal position for muscle strengthening and the ideal position for orthosis that allows for both maximal grip strength and grip endurance. Thank you for listening.